Okay, great. So basically, I'd like to talk to you a little bit about if you each have a plan. And one of the biggest things we're finding out in this pandemic is that people really did not have a plan at home. And I think we've all been in Florida ready for tornadoes and certainly hurricanes and floods, but we've not been ready for, we're on the discussion slide. Can you see the discussion slide?
Yes.
Okay, very good. But we've not been ready for a pandemic of this nature. There have always been about every 100 years a pandemic like this, but never to this magnitude. And so one of the big things that families needed to learn, let me go at the family level, and then we'll move actually into the business level. But one of the things that we realized that families did not have are masks, whereas many Europeans and many Asian countries, every person had a mask. We did not have masks. So that's one of the things that now families, when they have their preparedness kits, we're asking all of them to remember to have a mask. Secondly, we found out that a lot of families did not have thermometers. And that was another important aspect of this pandemic, for people to have thermometers handy. Another one was something as um, probably nobody thought about it, but having a supply of disposable gloves. And I know that one of the things that people don't often think about is that, why would I need disposable gloves if I'm not going to be picking up anything harmful? Well, in this pandemic, we're asking all family members when they go shopping to really wear gloves, because we do know that the famous disinfectant wipes are at a big shortage, and hand sanitizer is in shortage. So that plastic or disposable gloves is something that, as we prepare for the future. Now, I should say that this COVID-19, for those of you that don't realize that COVID-19 is really, has been around for a long time under such names as SARS and MERS in different variant forms. And there are 4 other forms of this that all have potential to become viruses. So I think as we talk about family planning now, one of the most important things that I'm going to be stressing is that when people have their, their goal packs with the things for the hurricanes in Florida in particular, that we also keep such things as Clorox wipes or any type of disinfectant wipe, and that we also have the disposable gloves, and always a mask, one mask for every person. If we're not going to work in the healthcare industry, we really don't need the N95 masks, but we do need simple cloth masks. I do recommend those. And do you have backups? In other words, make sure that with your preparedness planning, whether it be at home or in the office, that you have backup planning, and that means backup supplies. One of the things for businesses that we're finding now here in the United States, not so much in Europe, but in the United States, is that we didn't have enough supplies, such as the disposable gloves and certainly as the masks. And a big one is that small businesses did not have enough of the Lysol wipes and they handy wipes, that they thought if they had 1 or 2 in storage to wipe off counters, but now we need them as a way of life. So I think that's a really important aspect to remember, that you have backups in your businesses as well as your home. Always have 1 extra. And we love to say this little sort of anecdotal story. Don't forget to roll up the extra toilet paper. There's been a joke around the United States, not so much in Europe, but that we've had a shortage of toilet paper. And the reason why is very simple, is you're not going to work. You're not going out to eat. So obviously you're going to have a shortage because you're going to be using more toilet paper at home. But what that's taught us is that we should always have at least 1 extra, not to hoard it, but that we should have 1 extra at home, and even in our businesses, especially small businesses. And then always remember, do you have a network outside of your home, your city, and your state that can help you in any kind of a disaster, whether it's a disaster of a pandemic magnitude or not, any hurricane, any tornado, any flood? Always make sure that you have a contact and a place to go in case you do have to relocate. Now, we do know that a lot of people came to Florida. Some people went to rural areas. And I think if we were to put under this one here, one of the things we're learning from the Midwest is that a lot of people have come back to the Midwest during this time from large metropolitan areas. So I think that's something for us to consider for the future. For the work challenges, I believe that in this pandemic, we are going to see some significant, I underline, work changes in our environment. And let me just tell you what I call my top 3 list. I think number 1, for a while, for probably, again, the next 18 months or so, we will probably be wearing routinely, if we have contact with the public, we will be wearing masks. Secondly, I think that the surface cleanliness will be critical, and that we will make our own disinfectant out of Clorox and water if we can't find the wipes, but it will be essential. Doorknobs, any type of public surfaces will have to be often cleaned, and we will have to have a plan for that in our work environment. And then thirdly, what I think will be is social distancing. We will continue at least for the next 18 to 24 months. And I generally, in my newsletters that I do each day for my staff, I look at all the literature from around the country, because obviously I'm interested as well in the Czech and Slovak republics, but they're part of the EU. So I really go beyond that, and certainly into Asia, New Zealand, and Australia. By the way, New Zealand is probably going to be the first country to totally put the virus to rest, it looks like. So I think that, again, the masks will be here around, the wiping the surfaces will be here, and that social distancing for at least the next 18 to 24 months. I think that we will open up, but it will be very, very different. And 80% of the American public is still afraid of what is going on, and is cautious about that. So, and because we don't know it, just yesterday, they found some COVID-19 droplets on in the air, especially near manufacturing plants. So that's going to be an ongoing area. If it's in the air, again, all the more that we need the masks. Secondly, education will change dramatically. And I say that dramatically in that most schools had to change, they might have had online curriculum, but they've had to change it overnight, basically. And I think we're going to see, if I were a college president again, I would say that I would not be building dormitories anytime soon, because I think online education, not totally, certainly not totally, but I think increased online education will be here, it will be a reality. And I think that we're going to see more students choosing a combination of, you know, courses in person and more online. And what's the biggest change here is that international universities outside the United States are going to be doing more of this. And just let me give you a little anecdote. Having been in education for so long, that we were always ahead in online education here in the United States. But this pandemic has caused the entire world to convert to online education. And in Europe, that's always been sort of oh, we really don't like it as much. We prefer face-to-face, but this has changed it. So if I were a great investor, certainly technology and IT and online education is going to, it's not going to replace, as I said, but we're going to see far more of it. Thirdly, jobs. And this is one that we talk about a lot now. I think that probably 20 to 25% of the jobs that we're not working from home now will be looked at very closely, and we will probably see up to 20 to 25% of these continue to stay at home because certainly that reduces on costs of driving, it reduces on public transportation, and certainly it also reduces on the work time, travel time. And if they can be just as adaptable working from the home, I think you're going to see that in a lot of sectors of both business and education, as alluded to earlier. And will the job changes influence the economic environment? I'm not really sure what the economic environment. I've been speaking to a lot of economists, especially on the museum front and nonprofit front, and it seems that there are so many unknowns on the economic front. The two major factors that appears that will influence the economic outcomes of this pandemic are, number one, how we can open up and when, and secondly, the safety, and I underline the safety of that opening up. And I think personally, as a disaster and emergency specialist, it's going to have to be very, very slow. It's going to have to be very planned. And I think it's going to have to be very purposeful and with meaning. We cannot just open up to open up until, as you both, all of you know, we get a vaccine and until we get a treatment. And I think the vaccine is going to help assure it. The treatment will certainly be the bridge, but we need the vaccine. This fall, and I've talked to a lot of my health colleagues, this fall we're going to be confronted with what I call the triple play. The regular flu season, the cold season, and then certainly the COVID-19 season. And it keeps mutating. So, but we will be, this fall is a triple play fall. And the migration from the cities to more rural areas is already happening. Is that going to be permanent? I don't know. In Europe, the same thing. People were leaving the cities now to stay in for the extended time in their little cottages. And I think what the biggest change is going to be that Generation X, Z, I should say, and the Alpha, which are the 10-year-olds right now, they are going to create a whole different scenario. If I was the historian in 2050, I would say 2020 really changed the next generation, which is certainly the Alpha generation, but even Generation Z are going to create a much different world than we baby boomers and a much different world than the millennials even. So stay tuned for that one, but I think that's going to be critical. And as we talk about this period, I hope that all of you are journaling, and as we talk in the future of this webinar, that the journaling and stories and lessons learned, because we are really creating history. I never thought I would live to see history being created in such magnitude as it is right now. So we'll go to the next slide, that how we're going to hope and cope with the idea of unemployment. Unemployment is at an all-time high since the Depression. And how are they going to re-enter the job market? They will re-enter, most people agree, but it will be slowly. And I did a projection model for a colleague of mine here. And what I said is that, I said this in March, that it'll be 18 to 24 months. And I think it's really approaching that, even though we will open up slowly. But people will get into the job market. But let's take one of the biggest sectors that were affected, and that was the restaurant industry. And we know now that the restaurant of the future will probably have paper disposable menus, will not have formal table settings when you walk in. It will be brought to you with people in gloves, your silver and your glasses. The plates will be brought from the back. They will not be sitting there. And when you do sit down, if you move to a table and the dishes have already been set, they will be taken away and rewashed. So there are going to be lots of little changes, and we all think that probably for the next year and a half or so, the tables will be set far apart and people will not have a lot of close contact with each other. So how do these people get back into the business? They will, but it'll be slower, because obviously if a restaurant that seated 200 will only seat 120 now, there will be less need for all that staff. So we will have to find other ways to find employment, especially in that sector that we really depended on for so much of our food, through restaurants and even through the social activities of nightclubs and so forth. Will they even attempt to retrain the workforce? I think that's going to be a study for a lot of what we would call our community colleges. What other kind of jobs? I think certainly technology. I think one thing we've learned now from all of this is that in this country, about 25 to 30% of all the cases were in long-term care facilities. In Europe, it's 50 cases. And so I think we certainly have to retrain the people maybe in our long-term care facilities, give them additional training skills, because they're taking care of some of our most vulnerable populations. So maybe people may have to change jobs and retrain into different fields. And will new types of jobs evolve? I do think that new types of jobs will evolve from this pandemic. And let me just give you some of my insights of what I think some of those jobs will be. I think one of the jobs that we will see evolving will be in the delivery systems of food delivery. I think people are getting used to, in some areas, just driving up and getting their food and taking it home. I think grocery delivery will become even more common. I think that people will, as we talked about just before the start of this webinar, that people will also even probably go to theaters. Outdoor theaters will be more popular, and they were closed in a lot of places. So I think that new types of jobs will evolve from some of the changes that will be because of the pandemic. I also think that one of the things in China after they started to open up is that outside of apartment buildings, they found just tons and tons of boxes, empty boxes. People were ordering a lot more. And I think that, certainly the order business will, the Amazons of the world, I think will be doing very well throughout all of this. So there will be different jobs, but they will be a little bit different because people are going to adapt, I think, to a little different lifestyle. Will it come back in 2 years? I don't know. I think that some things will change for good, not good or bad, but I think they will for the long-term change. Will there be gender differences in the job market? That's a very interesting one. I think that homeschooling certainly has come upon both men and women now, male and female, in this, as mom and dad are both at home, if it's a two-parent home. I'm not sure that there will be that many gender differences in the job. I think that if anything, because some new jobs might open up, like in food delivery, like in homeschooling, where people, they will share more. I think that there will be less different. I'm personally seeing and predicting that there will be less gender differences as a result of some of these more entry-level type jobs in the future. Will the home environment definitely be impacted? Again, the sharing of responsibilities for homeschooling, if people decide to do more homeschooling. I think in terms of, I've been hearing reports that now people, two parents living, or two individuals living in a home, that they've been cleaning more, that they've been sharing responsibilities. So we'll see, but those are all questions that we have to ask. Will unemployment impacts homeschooling, and will there be more of it? I'm hoping that unemployment will not impact it. There's even been some say that we should maybe even pay the parents if they're educating the children. I don't know. These are all, we've never in this country been so impacted by a total lockdown, and certainly by not really almost a stopping of the economy. So will there be more of it? I'm not really sure, but I think that homeschooling may increase a little bit. And I think that I'm not sure if unemployment may or may not. We'll have to wait and see, but I would certainly monitor that in the future. Next slide, planning and migrating for an uncertain future. I think that I encourage all of you to make sure that you document what you're learning from this pandemic, because we can teach future generations. And I'm recommending that all people keep a journal, and it's not too late to start one if you haven't, because this is not going to go away quickly. And because this is something that you can pass on. I was lucky enough to be able to receive a couple of journals from families from the pandemic of 1918, the Spanish flu. And they've been just rich with stories, and even talking about medical conditions. So I really encourage you to, we at the National Czech and Slovak Museum are actually creating a time capsule that we're going to be filling with stories and artifacts. Obviously masks will be one of them for the future, and we're going to bury it in November of this year. So I encourage you to do that. And do you think that you'll do anything differently? I can't speak for you, but I think with your families, when you're home shut in, that you definitely talk to your families about this. And then you have to ask yourself, will the new normal be a big change for you? Are you prepared, going back to the very first beginning of this program, are you prepared for that new normal? And are you prepared? Do you have your mask? Do you have your gloves ready? Are you wiping off surfaces now? What are you doing right now? Because I think that for the next, again, several months, we will be in that new normal. So are you prepared, certainly, for that? I'd like for each of you to challenge you to start with a fresh look on this, individually and personally. What are you doing differently? How will you do it differently? And what do you plan to do in your family and in your immediate environment, in your community, in your work, certainly in your travel? And this is a big one. I've been talking a lot about travel because certainly our countries in the Czech and Slovak Republic, both of the borders are closed, as in much of Europe. And so what is that going to do to your summer travel if you have travel outside the United States? Most people are saying they're going to travel within their countries or their states, and certainly your social life. And I think that large gatherings probably, at least for the remainder of much of the year, will not be a norm at all. That they probably, we will watch football or we will watch things from afar on TV, but not in large groups like we were. And what about your purchasing decisions? Are you spending money to increase the economic sort of flow and cash flow in this country? Or are you saving your money because you're worried about the future? And that is something that I think is really important as we prepare in this pandemic, because unlike a hurricane, unlike any other type of disaster, this is affecting the entire world. So how the economy bounces back really is almost like a domino effect. So we need to really look at our personal finances and our own purchasing decisions, what can wait, and yet what is needed to help the economy. So these really are things that I hope you're discussing with your families as well as your businesses, because they're all interrelated. And I hope that those are good training points. I think one of the things in my experience with the pandemic is that people have really never discussed this as a reality. We talked about the pandemic in terms of it being a possibility, and we had the 1918 sort of guide, but we've never talked about the pandemic as being actually a reality. So I think that's really important for you to discuss in your businesses as well as your personal life at home. I think you need to identify what you're going to do as an individual and what you're going to do in your business. And as we sort of begin to wind down for some questions, I really want you to think about the steps you need to take to plan, not only in your own businesses, but in your family, what you are doing and what you will do in the future with an issue like this or any other disaster. Mitigate means what can you do to prevent it? For example, in business, one of the challenges I'm hearing people tell me, everybody's working at home. We had nobody to sign our checks. And so they had to figure out a process of how they would sign checks to get people paid because it was a small company. And then another group said, well, we had, it was a restaurateur, and he said, we had all this food and we didn't know what to do with it. So obviously they gave it away, but yet how do you decide who to give it to? And how do you make sure that it's done in the right way? So in business as well as in our personal lives, what are we going to do to prevent future problems? Unlike a natural disaster where our electricity goes off or where our water, we don't have access to water. This one, we have access to most things. The only thing in this country, we did see some shortages of some things, like the toilet paper, obviously. But we're worried now in the Midwest about the meat issue because so many meat manufacturing plants have had to close down. So will there be a shortage? I don't think there'll ever be a shortage. There might be a period where it won't be as available as we'd like it. But we have to remember that as Americans, we tend to sometimes hoard, and we have to be careful about this. And so a response, I wrote recently an op-ed about this. I think resiliency and patience. If I had to say what are the two most important things to keep in mind during this pandemic, I would say resiliency, to be positive in spite of it all, and patience, that it will get better, but because there are so many unknowns and things that we have absolutely no control over, like the test kits, the accuracy of the test kits, how many people get tested. So resiliency and patience, I think, are the two. And then just realizing that a pandemic could occur again, and that now we, at least I think, have the tools. We were complacent as a world society. I think we never really thought about a pandemic hitting. I even never thought as a professor thinking about it in that light. So I think we need to make sure that we never take anything like this for granted again. And again, as we go back, equip your home with the items we talked about and prioritize what's important. And remember that in any emergency, I think this is the biggest thing to remember, things happen fast. Who would have ever thought 2 months ago that we would be in a total lockdown in this world almost? Who would have ever thought that graduations would be canceled, that weddings would be postponed indefinitely? and it can happen. So I think the best philosophy, besides the resiliency and patience that you can take, is that things happen, and in a disaster they happen quickly. So we must equip our personal lives first. You always have to take care of your family and yourself first. Then you take care of your work and the greater society. But I think too many people, forget about their personal planning. Do we have this at home? And do we have this when we need it? So always think of your personal planning first, then your professional planning, and then how you're impacting society. That's so important. Okay, with that, I think we're imperfect for 15 minutes. Are there any questions?
I think it was a tremendous presentation. I think you put a really great light on the topic, a lot of timely information, and this will be broadcast several times. And we appreciate incredible. No, I was shocked by some of the things that you were saying.
With all the information, yeah.
It's fantastic. I think that international trade will be impacted because a lot of the international trade is done people traveling to other countries, looking for clients, going to global business expos. So that whole part of international trade is going to be impacted tremendously, don't you think?
Oh yeah, Al, I'm glad you mentioned that, because if we talk about the international scope right now, two very poignant stories that I can tell you is I was recently on the phone, in fact, this weekend, with a group of colleagues from the Czech Republic. And although they're slowly starting to open up the country, they don't know when they are going to open up for tourism from other countries. And as you know, tourism is, for most of those European countries, is like for much of America, a major source of income. So that is, we've canceled tours here. The museum had a tour going to the Czech Republic and Slovakia. We've canceled that for August. And I'm seeing that most tour operators have canceled through August and even September. I think they're still a little optimistic for winter tours, at least to Europe, but it will be very cautious. And I think what I'm seeing from many of the European Union countries is they are doing things within the country now. Volkswagen, for example, opened up many of its plants throughout Germany. But the key is that cross-country travel. And so I think, business is certainly going to be impacted. I think, the shipping business may not be as impacted if people get back to work. Right now, if people can get back to the factories and can get back to industry, I think that the transatlantic shipments and global shipments will not be as big of an issue. But again, when I say that, I'm worried about the safety. If we look at COVID-19, it can stay on cardboard for 48 hours or more, on copper for 3 days. So, we have to make sure that what we're transporting is safe. And that's where I go back to that, what everybody is saying in the news, I think, when we get a vaccine. And right now, the good news is that many countries are looking at vaccines, and that's good, because we may need more than one vaccine that's effective, because think about it, if every person in the entire world needs a vaccine, how much vaccine we're going to need. So I think that really tells us that we're going to need an awful lot of vaccines. So it's okay that maybe we have 12 or 14 different groups looking at vaccines, because if it's effective, we may need it all. And I think the other big thing besides travel and shipping will be the residual effects of people that can never recover. And I think both internationally as well as nationally here in the United States, that's a concern, especially for the smaller businesses and even for some of the larger retail companies, because we've had such a long shutdown that they have not been able to recover from. And if they were at a disadvantage, they're at a real disadvantage, I think. So certainly the food industry, I think, is in good shape. Restaurant industry will have to make some adaptations. But I think the industrial, car manufacturing, I think they will bounce back. The last one that I worry about, though, is the airline industry. Yes. Right now, it's estimated that 60% of the planes are grounded and about 90% of the flights have been changed or canceled. So that means I was recently taking a student to the airport, and he told me on the plane with him, there were only 2 other people. And he was going from from Miami to the Midwest, and there were only 3 people totally on the plane, and 4 airline attendants and the 2 pilots. So that tells you that people are afraid. That goes back to that. So everything is going to be effective. Again, the resiliency, how quickly we can bounce back, and patience. And the denominator, though, for both of those, I think, has to be safety. And until we know what that safety error margin is, I just got an email today about that now they're seeing more children diagnosed. And that's, you know, we kind of thought children were not totally immune to this, but we didn't see as many children, and now more children may be diagnosed. So those are all things that we need to be talking about. And the thing that's really frustrating for me as a public health professional is the fact that we don't know. There are so many unknowns in this. And you can't say, unlike, say, Ebola, we know because we don't have the vaccine. But there are so many new things that keep becoming identified with this virus. And that's where the danger, I mean, I think when people hear that 80% of the people who have it are asymptomatic, that means 80% of those of us on this call might even have it, but we don't show any symptoms. And that's a real issue. And because we don't show any symptoms, we can pass it on. One person can pass it on to hundreds of others. And that's why that contact identification through our mobile phones or through apps on our watch may become a normal. Certainly in the United States, it's being discussed with some trepidation because people don't want to share their personal information. But that contact tracing is really, really important because it shows where you've been and who you could have been in exposure with. We had a case here in the Midwest that someone, a mature couple, I like to say, a mature couple had stayed at home. They were so good. They had their groceries delivered, and he went to get a gas to the gas station, and just loaded his car up, filled it up with gas, went home, did not wash his hands. Guess what? He ended up in the hospital with, that's how they traced it, that he got it from the gas pump. And so that we have to be so careful about, you know, again, this, that patience and you know, wiping down and making sure that we wipe our surfaces. And so now when I get gas, I take from home, I take a Clorox wipe, and I take it and I put it on the handle. When I take it down, I put it in there. And in fact, I couldn't find any Clorox wipes, so I had some in my suitcase that were travel ones. I keep those in my car now, and I just, when I go for gas, I take one out and use that and wipe off the handle of the pump.
Yes, like you mentioned, some of the industries that are being impacted very hard are, for example, the event industry, because as a Chamber of Commerce, we do a lot of events, like 100 events per year. And we're just a Chamber of Commerce, so I can imagine organizations that are 100% events, you know, that they are doing for living all the time events. So this industry right now is dead because nobody wants to meet face to face.
Right. Yeah. And I think, you know, Maria, what you're saying is it's a cycle. If we want to use that term cycle, what's happening because you don't have the events, people aren't traveling to the events, people are not, why do you think car insurances are giving your money back now? I just got a $50 rebate for my car insurance because, you know, I'm not driving so far to work. And so I think there are about 10 insurance companies that are giving you money back for your car insurance. And, even without asking, they give it to you because they know what you drive and what you're not driving now. Is that when you have an event, you're impacting the hospitality industry. They may not arrange for their hotel rooms. They may not fly in. So you're, you know, the transportation industry, they may not buy food, the restaurant industry. So everything is so dependent. And I wish, I'm not an economist, but I think this, I keep saying for the public health and medical field, we have enough research for the next 20 years to look at. But I think from an economist perspective, we are going to be looking at this for years and years to come, because what is the impact and who will survive, I guess.
Yeah, another question I have, somebody's emailing me this question about your presentation in regards to education. You mentioned something about schools, homeschool, right?
Yes.
And do you think that schools actually are going to start next year on September?
Well,
Well, the
yeah,
school
I
year.
do. I think they will start. I think they'll. One of the first countries to open up now has been Denmark. Sweden, in fact, Sweden never really closed down, and Sweden's going to be an interesting country to watch. But Denmark did close down, and Denmark opened their schools now. And I called a colleague from Denmark and also one from Germany, where they slowly started opening schools. And what I found out from them is that they really spaced the children's desks apart more. They had them wash their hands every hour. They had to go wash their hands every hour. Playground, they let them go outside and play, but no contact sports. It was like they could run or swing or do things so that they, could stay away from each other a little bit. And they were not wearing masks. But they did to go outside. In the classroom, they were not, but they did to go outside. But they were making them wash their hands. So I personally think we will come back in September, but I believe that it will be a very well planned, very calculated approach to how we come back. I think, again, like in restaurants, the schools will have the desks farther apart, I think, and I think we will definitely have, we may have mask wearing, I don't know, but I do think that social distancing and hand washing and wiping of all surfaces, cleaning of the schools, it will be the other job that people don't like to be in that job, I know, but I think the cleaning jobs and sterilization like they're doing in the grocery stores, disinfecting will be a big part of the school opening in the fall.
I think I see a lot of very good preparation from education on how they're really taking care of the things you mentioned. I mean, I wouldn't even think of all those things that you mentioned at the schools, but they're really thinking this out and taking good precautions. So that's very, very good.
And I think businesses are really going to have to be thinking about this too, because, for example, when we have a museum store in our National Czechoslovak Museum, and we're thinking about, how close are the things together, and we have to put up signs so people don't touch things, and little things like that, so that, let us show you the item with our gloves. And so I think that going back to my slides about sort of the planning, I think businesses, homes, schools, nonprofits, at least in the next 18 months, every sort of faction in society is going to, churches, we haven't even mentioned churches, they're going to have to look at it. Theaters, when you go to the theater, we was reading someplace that maybe every third seat, you could only sit in every third seat. So that these are all going to be looked at very, very carefully. And I think that, again, the resiliency and patience are going to be our guiding light. And knowing that there's no one answer except safety. That's all I can say.
Yes, that's the key. Well, one thing that we're definitely going to do is every month or so, we want to get an update from you on this crisis because you definitely have a good insight and research in what's going on. And I think you're going to be a regular commentator on our programming here because it's exactly what we need to hear. And you're going to keep us up to date. I think that's going to be very welcome.
Absolutely.
Anything I could do, because again, after teaching this for 14 years, it was kind of interesting to now finally actually put it into practice and to monitor. I usually comb about 5 or 6 newspapers every day, and I watch 4 major networks, and to help people, at least my staff and my board, understand that there's no one answer. There's not one answer, and we need to really look at the big picture. And again, I think in this country, as well as most of the world, the major issue, and it won't surprise any of you online now or listening, that the major issues right now is the lack of testing, the accuracy of the testing, and the unknowns with what the disease really does, what the virus really does. I think those are the three biggest factors, the lack of testing, the accuracy of the testing, and then to know if you have it. I didn't mention this in my presentation, but there was a study done in Italy with a young woman, 43, who has had the virus now for 60 days. And so even though she's been tested so many times, she keeps coming back positive. She's somewhat asymptomatic. She did have it, but she still has some symptoms, but she's had it for 60 days. And then in another group in South Korea, they got it back again. Another group, a middle-aged group, had the virus, and a group of them got it back again. So we have a lot to learn.
Yeah, definitely.
Yes.
Thank you so much, Dr. Cecilia Rokusek. You're going to be our future guest for updates in terms of, all these crises and the
Yes.
COVID-19.
Yes.
Definitely,
Great.
it
And we'll
was a
get this
super
worked out so
interesting
that we don't have, I felt badly about these
presentation and
issues.
very important.
Okay, very good. Thank you. Bye-bye.
Thank you so
Thank you.
much.
Have a good
Bye-bye.
day.
Bye-bye.
Appreciate it.
Bye-bye.